Hello and welcome to this webinar on advocacy and support networking, which is one of a series of webinars aimed at giving our patients and their families and carers useful tools to help manage both their health condition and their wider circumstances. I'm Colin Bexley and I'm a Citizens Advice Advisor based in the family support team at St Richard's Hospice. And I'd also like to introduce my colleague Sharon Johnson, who is a senior healthcare assistant within our Living Well service. Today, we'll be running through 3 brief presentations with you. In the first, Sharon will talk about self-advocacy. This is about standing up for yourself, knowing your rights, and getting what you want. In the second presentation, I will talk about self-support resources around financial, legal, and similar issues. And finally, Sharon will discuss developing a good support network. This has many positive benefits, such as higher levels of well-being, better coping skills, and a healthier life. The webinar will take 20 to 25 minutes in total. There will be a copy of the slides used in the presentation on our website, so you shouldn't need to write anything down if you don't want to. And without further ado, I'll now hand over to Sharon to talk to you about self-advocacy.
Hello everyone, I'll share my screen with you. So self-advocacy is about empowering ourselves. And there are 8 steps to being a self-advocate. But before I talk about those 8 steps, just some information in general, really. I mean, sometimes we find that dealing with professional people is difficult. Some may not behave in the way we would hope. So be prepared. This will help you get the most out of the service. Take notes of the questions you want to ask. Take someone with you for support. We may not remember all the information, especially if we're feeling stressed. Take notes of the answers you receive and/or ask the person to put it in writing so you can read later and digest the information. Don't be intimidated. Feel confident that you are entitled to speak up for yourself. If you want to make a complaint, ask to speak to the manager or supervisor. So the first step, believe in yourself. You are unique and valuable. You are worth the effort it takes to advocate for yourself and protect your rights. Step 2, know your rights. You are entitled to equality under the law. The Equality Act 2010 protects you from discrimination. Human Rights Act are basic rights based on dignity, fairness, equality, respect, and independence. Decide what you want. Clarify for yourself exactly what you need. Step 4, get the facts. Step 5, target efforts. Who is the person or organisation you need to deal with to get the action on this matter? Talk directly with the person who can best assist you. It may take a few phone calls, but it's worth the effort. Express yourself clearly. Be brief and stick to the point. Don't allow yourself to be diverted or ramble on with unimportant details. State your concern and how you would want things changed. If you're told you cannot achieve this, ask them to refer you to someone else who may be able to give you what you need. Assert yourself clearly. Don't lose your temper. Speak out and listen. Speak out and then listen. Respect the rights of others, but don't let them diminish you. And be firm and persistent. Dedicate yourself to getting whatever it is you need for yourself. Don't give up. So there's locally On-Side Advocacy is a charity working across Worcestershire and Herefordshire who provide a range of support and services to ensure fairness and equality for adults with mental and physical ill health, sensory impairment, learning disability, drug and alcohol misuse, and they also support older people and carers. Thank you, and I will hand you back to Colin.
Okay, thanks, Sharon. And I will now see if I can bring up the slides for my part of this. So let's see. Okay. Does that work for you, Sharon?
It does.
Okay,
Yes.
I will assume. Okay, so as I said at the beginning, I'm a citizens advice advisor at St Richard's, and we are here to help patients and families with a range of financial, legal, and other issues. I'm going to briefly tell you a little bit about the kind of issues we help people with, but then I will focus on how you can get information for yourselves on these issues online or from other agencies. So Worcester Citizens Advice have 2 advisors based within the family support team at St Richard's Hospice, and referrals to us can be made by any member of the St Richard's Hospice team who is involved in the care and support of you or your loved one. And the kind of things we help people with, firstly, a set of primarily financial issues. So advice about welfare benefits and grants, helping people with debt issues, helping people make decisions about what to do about pensions, and supporting people looking into the costs and charging systems around home care and care homes. But also a range of other issues which often affect patients and families going through issues of terminal illness and bereavement. So things like powers of attorney, wills and probate, housing and employment issues, and some others. And as well as advising people ourselves, we can access a range of expert colleagues in our Citizens Advice Service in Worcester, and we can refer to them when needed for specialist debt support, housing support, for helping people minimize their expenditure through looking at spend on things like energy, water and telecoms, and more expert advice around choices and decisions people can make around their pensions. Now, in terms of things that you can do for yourselves, you can find information on all of these topics and more on the Citizens Advice website. The link to it is on that slide, and here's an image of what the front screen of the website looks like. I appreciate that not everybody has access to online resources or feel comfortable with them, but equally, lots of people can ask friends or family to help them with this, and it's increasingly the best way in which you can obtain information and support. So on this front screen, in that blue bar near the top, you can see sections on benefits, work, debt and money, and a whole range of other issues. Below that, you can see a search for advice box in which you can put in any words you want to try and find advice about the topic that you're interested in. And down the right-hand side, there is a section which tends to be about topics which are very popular at the moment. And for the last many months, not surprisingly, these have been mostly about coronavirus advice. Okay, now I mentioned the topic of benefits, and this is really one of the most common issues that we deal with, because people whose circumstances have changed often want to understand whether they can access any additional welfare benefits and grants. And you can look at this for yourself by using one of a number of public benefits calculators that you can access on the internet. And a couple of the most popular ones I've given the links to here. So you put in your details of your family, your income and other financial information, and it will tell you what benefits you're entitled to and how to apply for them. Turn to Us, the second link there, also have a very good tool for searching for grants that may be available to you. A lot of grants are available to people because they've historically, say, worked in a certain profession or been affiliated with certain societies or groups. So it will ask you a whole set of questions about the background of the person that wants the grant, and then try and match them to something suitable. So that's really useful. I now want to mention a few of the many charities and other agencies who are out there and who provide very good free support and advice. Some examples where we encourage people to talk to them a lot is the Age UK service in Herefordshire and Worcestershire, and the Worcestershire Association of Carers. Both Age UK and Carers UK also have very good national websites which provide a lot of information, a lot of very good printable fact sheets, and also provide free helplines where you can actually talk to somebody and get a whole load of free advice. And I've also mentioned there on-site advocacy, who Sharon talked about earlier, and who are a local charity providing access to social prescribing and advocacy services. And then finally, I've just listed out here some of the websites that we find the most useful for advising people on the range of issues that I've talked about, and which you can use directly yourselves. And they are very user-friendly, and many of them, as I said, provide access to free phone lines as well. So in summary, we are here and can help our patients and families of the hospice, but there is lots of other help out there online and through free phone lines. And I hope that this will make you feel more empowered to actually go out and start looking into these issues yourselves and get the information that you need. Okay, let me end my bit of presentation, and I'll pass back to Sharon, who's now going to talk to you about support networking.
Thank you, Colin. So welcome back, everyone, to my talk on support networking. So studies have shown that to maintain our mental health, having a good support network with strong relationships that you can actually count on is vital. We have been part of a support network throughout our lives, but may not have considered this in a formal way. Our support system is constantly changing according to our circumstances. Thinking back to childhood, who were the people that supported you then? Parents, grandparents, extended family members, family, friends, maybe going back to nursery, primary school, your teachers there, and your neighbours. Then as we grow older, the members of our networks change, we make new friends, we may join new activities and interest groups, and we develop new relationships as we move job or relocate perhaps. There will be people who remain in our support group, but others will leave. Our support network tends to change according to our circumstances. Family, friends, and work colleagues offer support in good times and bad, helping us feel socially connected to a larger social group. This is because humans are social beings, not designed to live in isolation. Feeling that we belong and having supportive relationships is part of our basic needs. When a serious life-changing event occurs, it's the people around us that we turn to for support. You may have been faced with a cancer diagnosis or told that you have a life-limiting chronic illness. You might find that your role has changed and you have become a carer. Perhaps somebody close to you has died and you are grieving for their loss. It's on such occasions that you need your support network. It is important to have a support network made up of different people. They help us to see the problem in a number of different ways. Having just one person in your support network means that you might over-rely on that person and potentially exhaust them. An important question to ask is, what do you want from your support network? This may be an occasion when you need to recruit new members to the support group. Research suggests that emotional and practical needs ideally should be met by all of the following: a coach, a support group, role models, and professional support. So I'll just talk a little bit about each one of those. So the coach, this is often a spouse or close friend. The role of this person is to give emotional support and offer an objective view of the situation. Support groups. Illness-specific support groups offer an opportunity to make contact with fellow patients. In addition, these groups often provide a wealth of information about the health condition itself and ideas for managing the future. Role models. So some people find that reading about how other people and their families have coped with illness reassuring. That's the feeling we're expecting so that the feelings we're expecting are actually normal. The stories of other sufferers can be empowering and offer a different perspective. Professional support. So illness can often cause us to reflect on our lives. We want to make sense of what is happening to us. It can also raise issues from the past which we may find difficult to cope with. The services of a counsellor or psychologist can provide an outsider's view on your situation and give support. So where to find help? Emotional help, so with family, friends, the GP, so a referral for counselling or psychology, support groups and religious groups. Practical help, again, family and friends. Remember, you need to ask them. They don't know what you need unless you ask them. Citizens advice, so as Colin was saying, for finances and benefits, social worker, Age UK and NHS Befrienders. And for social help, again, NHS Befrienders and Age UK, and again, social prescribing from the GP, or on-site advocacy as well. And information, always go to the GP, the CNS, your local community nurse specialist, or the hospital team, St Richard's Hospice, or your local hospice, and disease-specific groups. So the most important person in the group is you. It can be very difficult to accept help, especially where in the midst of adapting to a new situation or circumstance. People often think, I don't want to trouble anyone, or there's a lot more people worse off than me. That may be so, but it does not lessen your needs. We are concentrating on you, your needs and your concerns. So your role in the support network is to concentrate on your well-being. Some people view well-being as being self-absorbed or selfish. It isn't. Well-being enables us to build emotional resilience and the ability to manage stress. The NHS suggests that there are 5 things that can help us improve well-being. So to connect with people, as previously mentioned, we need to be in contact with other people. Good relationships provide emotional support. They also help us build a sense of belong and self-worth. Be physically active. This does not mean going to the gym. Discuss with your GP, healthcare professional about a gentle exercise program. Just a small amount of exercise can help you raise self-esteem by setting goals and achieving them. Evidence has shown that exercise causes chemical changes in the brain, which can improve your mood. Learn a new skill. You might try taking up a new hobby or engage in something you used to enjoy. Give to others. Research suggests that acts of kindness and giving can create positive feelings and a sense of reward and self-worth. This could involve something as simple as saying thank you to someone who has done something for you. Pay attention to the present moment. Mindfulness can help you understand your better self. It can help you, yourself better. It can help you change the way you approach a problem. In conclusion, having a support network is something we've probably all had through our lives, but never really recognised it in a formal manner. Thinking about the specific help you need to support you in your situation allows you to develop an action plan for the future. Thank you, and I'll hand you back to Colin.
Okay, so all I really wanted to say in conclusion is thank you for watching today. We hope you found our webinar useful and empowering. And if you did, please investigate the other empowerment webinars available on the St. Richard's website, because there's lots of great information and tips for you in those as well. And that's it from us. So thanks once again.